Demand for nurses. The demand for nurses is at an all-time high due to 1. Aging population with complex health problems, 2. More uninsured people seeking healthcare due to the ACA, and 3. Medicare reimbursement rates based on hospital readmission rates for 6 conditions: heart failure, heart attack, pneumonia, hip or knee replacement, COPD, and coronary artery bypass graft surgery. Employing nurses with higher education improves patient outcomes, and more skilled nurses are needed in primary care, public health, and long-term care as care coordinators, managers, and patient educators. Nurse practitioners are taking on primary care roles due to a shortage of physicians, but some states limit their independent practice. The projected employment for RNs is 3.3 million, which is more than any other healthcare profession. Education and career pathways. Becoming an RN requires a 2 to 3 year associate's degree or a 4-year bachelor's degree. Other healthcare practitioners such as medical social workers, OTs, and speech therapists require a master's, while audiologists and physical therapists require a doctorate. Nursing education traditionally focused on acute hospital care, but now emphasizes chronic disease management in community settings. The 2010 Institute of Medicine, or IOM report, called for 1. Increasing the percentage of BSN educated nurses from 50% to 80% by 2020. 2. Doubling the number of nurses with doctorates. 3. Implementing nurse residency programs. And 4. Encouraging IPE for collaboration between nursing and other health fields. Barriers to advanced education include cost and lack of work flexibility. The IOM recommended that employers cover tuition and offer part-time benefits to help earn RNs higher degrees. Bridge programs exist to help nurses advance: LPN to BCN, or ADN to BCN or MSN. Many ADN graduates do not complete a BSN. Pathway to becoming an RN. Number 1. Start as a certified nursing assistant or CNA. 2. Complete a 2-year ADN, a diploma program, or a 4-year BCN. 3. Pass the national licensing exam, which is the NCLEX RN. Or 4. For advanced practice roles, nurses need a master's, MSN, or a doctorate, DNP, or PhD. Since the 2010 IOM report, DNP enrollment increased by 161% and PhD enrollment by 15%. As of 2018, 45% of nurses held a BSN, 30% held an ADM, 19% had a graduate degree, and 2% had a doctorate. LPNs versus RNs. LPNs are licensed practical nurses. They train for 1 year beyond high school. They administer medication, take medical histories, and record symptoms, and they work under RNs or physicians. RNs, or registered nurses. They have more complex responsibilities, including direct patient care, care coordination, disease prevention, and patient education. They can become advanced practice registered nurses or APRNs with a master's degree. Future job growth and work settings. RNs and LPNs will see job growth in skilled nursing, rehab, and residential care facilities, home health and ambulatory care, long-term care facilities, oncology outpatient settings, and non-traditional settings such as schools. Specialized nursing roles. Clinical nurse specialists provide advanced patient care in specific fields. Forensic nurses investigate abuse cases and assist in legal matters. Infection control nurses track and prevent outbreaks in healthcare settings. Nurse educators train new nurses and develop educational programs. And nursing informatics use data and technology to improve patient care decisions. Work environment. Most RNs work in hospitals, clinics, and long-term care. Shifts vary. In hospitals, most RNs work 3 12-hour shifts per week. In skilled nursing, they work 5 8-hour shifts per week. In ambulatory care, they work day shifts, and in home health care, they have flexible scheduling. Some work hazards include exposure to infectious diseases, radiation, and hazardous chemicals. They also have a risk of injury from lifting patients. Finally, education and licensing requirements. There are 3 paths to become an RN. You could get a BSN or a bachelor's degree, which is 4 years, an ADN or associate's degree, which is 2 to 3 years, or a diploma. All RNs must pass the NCLEX RN exam, and specializing requires a master's or higher.